I knew everybody was gonna care about this one.
It's important. Which one I did?
To the right, yeah. That'll
All right.
move it. Okay.
All right. More than 500 people are expected to die from cancer this year. More than 1,500 a day. That's 1/2 of men and 1/3 of women that will develop some form of cancer. Yes, that number may include you and me. So I asked this question. Who wants to live a full life without becoming a victim to a serial killer named cancer? I know I do.
Of course it doesn't work. Did you take something out? No, over there.
I have to take it.
Press the right.
She's like, I'm pressing both of them. It just works.
Let me see it. I don't know. It was just working.
I'll pause it this time.
Yeah.
It's paused?
No, the time. The time.
I don't know.
Go check out your slide.
Try touching it, maybe.
Yeah.
Nope.
Use
No,
the
no,
use
like
the keyboard.
Oh.
Just press any key. Space key will work. There you go.
So you want to stand over here?
That's fine.
Okay. I worked in the medical field for over 13 years. I've witnessed the effects of cancer through losing someone that was very dear to me, my aunt. And, of course, the necessary research it took to stand before you today. Today I'm going to talk about cancer. First, I'm going to give you the true meaning of cancer. Secondly, I'm going to give you some of the examples of lifestyle risks that may increase your chances of forming cancer. And lastly, I'm going to tell you about the different methods of treating this serial killer. All right. Cancer is a disease in which abnormal cells divide uncontrollably and destroy normal body cells. Now, this means they go in, they on attack. They're killing off all your normal cells that provide your healthy cells to live. And they're supposed to die off, but the cancer cells go in and just take over, and they kill all of those cells. So that forms the tumors. According to the American Cancer Society, cancer is the general name for over more than 200 diseases. When I looked at that, I said, I didn't know there was that many diseases of cancer. Wow. If left untreated, cancer can cause you to become severely ill or even death. Now that I've told you a little about what cancer is, now I'm going to tell you the lifestyle risks that may increase your chances of forming cancer. Number one thing, smoking. According to cancer.org, lung cancer is the leading cause of cancer death. Cancer death. So when you're watching that annoying TV commercial, do not smoke, and the man with the trach, take heed to the warning before it's too late. Your diet. Research studies show that eating fruits and vegetables, staying away from foods that are high in fat, helps to keep your digestive system flowing correctly, and also provides your body with the necessary nutrients to function properly. Now, I know we like fried chicken, spaghetti noodles, I do. But just be mindful that our diets can also help prevent us from getting or causing cancer. Exercise. Lack of exercise helps the form of cancer. Along with eating a healthy diet, don't forget to exercise. It is recommended by the American Cancer Society, again, being physically active helps your blood flow. Now, this doesn't mean go run a 20-mile marathon out there, fall, and die of a heart attack because you wasn't ready, because I wasn't ready. It only means go out and walk in your neighborhood for about 30 minutes. Just enjoy the outside. Go back in, and you're cool. Sit on the couch and continue, like I won't do. Family history also is another risk for forming cancer. These cancers are known to have a genetic link. Breast, ovarian, bowel, cancer of the womb are just some of the genetic backgrounds that link to cancer. So that means everyone maybe have some form of cancer. Although you have a genetic background, that doesn't mean that you're 100% going to have cancer. It only means that your risks are increased. Now that I've given you the risk factors that may increase your chances of forming cancer, now I'm going to tell you the different methods of treatment if by any chance you may have to experience having cancer. Surgery is the best option for getting rid of cancer, of some cancers. According to the cancer.org, surgery is the first treatment option. If the tumor or the cancer can be taken out of your body, have surgery. Chemotherapy, radiation therapy, and different medications are just to name a few. Say no to cancer. By living a healthy lifestyle, by exercising, by knowing the risks, knowing your genetic backgrounds, it helps you know the risk of forming cancer. Today, I have told you about cancer. First, I talked to you about cancer. Secondly, the lifestyle risks that increase your chances. And lastly, the different treatment methods of treatment for cancer. So remember this. This serial killer by the name of cancer strikes any color, any age, any gender. Just say no to cancer.